Are you trying to get pregnant, or are you playing the high stakes game of no protection during intercourse in hopes of just not getting pregnant? Today, I want to go over with you when a woman is most likely to get pregnant, to either help you get pregnant or just to help you avoid getting pregnant. However, as a healthcare provider, my job is to advise you to use protection if you're not trying to get pregnant. Also, to use protection to prevent yourself from getting sexually transmitted diseases that can be passed on through the genitals or orally. If you decide not to use any protection, then just let me educate you on the most riskiest method in order to avoid pregnancy or to become pregnant if you decide to have intercourse without protection. And that is to use the calendar method to track your fertile days. Or maybe you just want to learn about the human body, the woman's human body, and how our fertility is largely affected by the day of the month. So first, you want to know how many days there are between the start of your period and the start of your next period. So let's just say you're on a 28-day cycle. Ovulation is when the ovary releases the egg. The period of ovulation is approximately 10 to 16 days before the start of your next period. Approximately halfway into you starting your next period, taking into account a few days before the halfway mark and a few days after the halfway mark, which is the period of fertility. Ovulation can be very difficult to detect if your cycle is not consistent every month. Those of you who have start-to-start dates, 28 to 30 days, the calendar method may not be that reliable. However, there are two other methods to check the time of your ovulation. The first way is to check your basal body temperature when you're resting. The temperature slightly goes up during or before the time of your ovulation. A good time to check is every morning when you wake up. But first, you need to know what your normal body temperature is every day. In order to do this, check your temperature daily and you'll get an average of what your normal body temperature is. And then all of a sudden, when the temperature goes up 1 degree, it may mean that you are experiencing ovulation. Also, a second way to detect if you're going through ovulation is to look at the discharge from your vaginal area. The mucus becomes more thin and clear. If you were to put it between your fingers, it would be much more stretchy because this allows the sperm to more easily locate the egg during fertilization. So when you guesstimate the time of your ovulation, you can get pregnant 5 days before ovulation. The reason is because the sperm lives inside of the woman's body for 5 days. Well, it's actually up to 5 days because it largely depends on the sperm quality, how well or how healthy your partner is, your fertility level, meaning how balanced the woman's hormones are. And as we all know, the older we get, the hormonal balance is a little bit offset, so it's much more difficult to get pregnant for a woman in her 30s compared to a woman in her 40s. Also, your vaginal discharge, depending on how healthy and thin that fluid is for the sperm to survive to make it to the egg, it can tell you if the sperm will actually last for the complete 5 days before making it to the egg. So, like I said, if the sperm can last 5 days, you are more likely to become pregnant if you have unprotected sex 5 days before the start of your ovulation. And then you're also likely to get pregnant if you have sex on the day of your ovulation or 48 hours from the time of your ovulation. Because the egg, once released from the ovaries, only survives 24 to 48 hours. So that is the gap at which you can become pregnant. 7 days where you can potentially have a baby. Alright guys, so I hope my information helped explain the woman's anatomy and when she's most likely to become pregnant. Stay safe, friends of YouTube. I hope you enjoyed my video. Make sure you like, comment, and subscribe to check back on my next educational video. Bye!